Hello everyone, I'm Dr. Archana, as you know, and in today's episode, going to talk about MTPs, that's medical termination of pregnancy. There are a lot of myths and truths about MTP, which I feel all reproductive age women should know. So, Supreme Court has given there is MTP law, and Supreme Court has given directions recently that now an anomalous fetus can be terminated up to 24 weeks only when there is a threat for the baby's life or the maternal life. Only then MTP can be carried out up to 24 weeks of pregnancy. But we frequently see MTPs that's happening irrationally, people going on taking MTP tablets over the counter in the pharmacies. There is no proper regulations for MTP. All these are leading to incomplete abortions, and sometimes when there is ectopic pregnancies, it is threatened for the ladies who take MTP pills over the counter, and they can land up in serious emergencies because MTP tablets, when given without consulting or without confirming the pregnancy in the uterus, if given, and if there is a tubal pregnancy, it can lead to fatality. So therefore, MTP pills should be taken out through a proper channel after scanning and consultation with the qualified person and a supervision which is recommended. Keep us following this channel for more updates, and you can ask your queries or drop your queries so that we can get back to you. And if you have any concerns or if you want any information regarding any particular topic, you can just suggest in the comment box.